Chandan Super Specialty Dental Care is Vadodara's first super specialty dental center, establishing the city on the international dental map. Packed with the experience of over 2 decades and garnering accolades nationally and internationally in oral care, Chandan Super Specialty Dental Care has now made a successful crossover to dentistry of the future, bringing in the latest technology to enhance dental care. Our exclusive specialty CRAC, One Visit Dentistry. We are the first in Gujarat to introduce in-house CAD/CAM German technology milled crown bridges on the same day. It's a one-visit dentistry for tooth replacement where crown and bridges are made in a single visit. Welcome to the scientific wizardry of the future. One visit, no impressions, highly biocompatible, no intraoral adjustments, internationally recognized, metal-free, highly aesthetic, long-lasting.
It was a root canal treatment. In fact, I had attended one seminar where Dr. Amish Mehta had bought this new machine where he mentioned, the crown would be fixed on the same day. No impressions, no hassles. It was absolutely pain-free. No after adjustments. Generally, after you get the crown from the lab, there are a lot of adjustments. Whenever somebody talks of hospital or going to a doctor, there is little fear in the mind. That what would happen, how would the treatment be, whether it would be painful. The ambience is so good, it doesn't feel you have come to an hospital. Both my children had crooked teeth and it was because of Dr. Amish Mehta. Both my daughters have got lovely straightened teeth and beautiful smiles. So that itself speaks for it.
Another highlighted specialty of ours is Invisalign. The Invisalign system is a virtually invisible treatment which uses an innovative approach to effectively straighten teeth with unique Smart Force technology that gradually moves your teeth to the ideal position.
I'm going through Invisalign treatment. Few years back I had done the normal treatment, but after 4-5 years it again got dislocated. Plus I was 27 years old, so I couldn't go through the normal treatment again, because those braces were very visible. Amish Mehta sir, he gave me an option that I can go for this Invisalign treatment, wherein I'll be very comfortable and I don't have to, it will not be visible, plus it will have the same effect like that of a normal treatment. The staff is quite punctual. I'm not so punctual. But they are very punctual. I also get an email when the appointment gets booked.
We specialize in orthodontic treatments, root canal treatments, teeth straightening, metal braces, ceramic braces, customized lingual braces, gum surgery, laser gum treatments, laser dentistry, laser surgery, conservative dentistry, cosmetic dentistry, periodical plastic surgery, cleft lip and palate treatments, functional jaw orthopedics, dentofacial orthopedics, wedding smile planner. Our most technologically advanced services include dental implants, crown and bridges, composite filling, inlay and onlay restorations, dentures, scaling sealants, fluoridation, veneers, teeth whitening, tooth saving, tooth extraction, emergency dental trauma, TMD/TMJ disorders, custom sports mouthguard, and many more. Our patient-centric facilities are manned by a specially trained dental team to provide them with utmost care and responsibility. Aided with the top-notch equipment and technology, we vouch and stand by our medical ethics to treat our patient like no other.
This clinic, I'm very happy to say, is one of its only kind in Gujarat. A lot of equipment which you see here in the clinic is not found not more than half a dozen clinics all over India. We ensured that whatever goes into the patient's mouth should be good enough. If we had to put it in our mouths, we would gladly do it. So that is the kind of quality treatment we give to all our patients, so that it's only the best, nothing but the best.
हम लोग पहले पैनोरामा कॉम्प्लेक्स में थे, 2 चेयर वहाँ पे प्रैक्टिस करते हैं।
वो टाइम पे बहुत छोटा एरिया था और ये क्या है कि ये बड़ी जगह है और सब इंस्ट्रूमेंट भी ज़्यादा है। उधर बहुत एक ही चेयर था और एक ही चेयर पे सब काम करना पड़ता था। अभी 12 चेयर है तो फैसिलिटी भी अच्छा है, पेशेंट को भी कन्वीनियंट रहता है। दूसरे सब इक्विपमेंट भी नया आए हैं, बहुत सारी फैसिलिटी है, कि अपॉइंटमेंट शेड्यूल है, वेटिंग एरिया अच्छा है, बड़ा है, फिर पेशेंट को कन्वीनियंट के हिसाब से सब कुछ है। अपॉइंटमेंट वाइज हम लोग को मैसेज वगैरह सब भेजते हैं, अपॉइंटमेंट देते हैं, उनको कोऑपरेट करते हैं। अपॉइंटमेंट इस तरह देते हैं कि पेशेंट को ज़्यादा तकलीफ नहीं पड़े, उनको कन्वीनियंट के हिसाब से उनका टाइम एडजस्ट करके ज़्यादा यहाँ वेट नहीं करना पड़े और स्मूथली ट्रीटमेंट हो जाए। ट्रीटमेंट पेशेंट टाइम पे आए तो उसका टाइम पे काम हो जाए, वो भी पेशेंट भी हैप्पी है, हम भी हैप्पी है।
Other clinics don't have the softwares which we are using, and that softwares are basically useful to the patients and to the doctors also.
जब भी पहले पेशेंट यहाँ पे आता है तो हमारी सबसे पहला कंसर्न ये होता है कि पेशेंट अच्छे से जाना चाहिए, उसको अच्छी ट्रीटमेंट मिलनी चाहिए। तो हम उसकी कंप्लेंट को ध्यान में रखते हैं कि क्या उनकी कंप्लेंट्स है, उसके हिसाब से हम उसको ट्रीटमेंट प्लान बताते हैं ताकि उससे फाइनेंशियल बर्डन कुछ ना पड़े, लेकिन ट्रीटमेंट क्वालिटी ऑफ द ट्रीटमेंट में कोई चेंजेस नहीं होता है।
Treating thousands of people and creating many happy smiles, here are a few testimonials from our patients from all age groups.
I mean, the way he speaks to us, and I had a lot of confidence the way he explained me everything, that how it's going to be done, what's going to happen. But when I really had my implant, I was really impressed with him. He's really so gentle. And he takes his own time, he doesn't rush, and there was no pain, no swelling, nothing. And he's really very polite. Then he personally calls up and tells and reminds me of his appointment. Or if he's delayed, then he also, phones and tells me. Well, they are very rare qualities what I find in a doctor.
मेरे दांत बहुत आगे थे, कुछ भी खाता था अंदर चुभने लगता था। और एक सर्जरी की हुई थी 1979 में नाक की, तो उसकी वजह से एक वाइन कट गई थी और वो कट हो जाने से एक दांत मेरा पूरा ब्लैक हो गया था। तो वो दांत का भी अमीश मेहता साहब ने रूट कैनल ट्रीटमेंट करवाया और उस पर कैप लगवा दी। अभी तो पता भी नहीं चलता है किसी को कि ऐसा कुछ है, बाकी उसमें कुछ दांत है ही नहीं। एक दांत, ये जो दांत दिख रहा है ये दांत है नहीं, नकली है। ये क्लिनिक में आने का हर एक एंगल से देखा जाए तो एक तो लेटेस्ट टेक्नोलॉजी है उनके पास, डॉक्टर्स और जो स्टाफ है टेक्नीशियन वो भी क्वालिफाइड है, हाइजीनिक लेवल पूरा मेंटेन किया जाता है। ऑर्डिनरी कैटेगरी में एक क्लिनिक आ ही नहीं सकता।
I remember the day when I had to get my teeth extracted. I was nervous. As soon as Dr. Mehta just entered the room, he put up his Apple Music, iPod. He played the music, and he just said to me, "Have you listened to the Dawn song?" And I was like, "Yes, sir, I have listened." Okay, listen it again. Within, I think 5 or 6 minutes, he said, "Okay, Shreya, your teeth is extracted." And I was like, "No, are you kidding me?" He said, "Yes, it's extracted. Now go and eat ice cream."
When I heard that I was going to get braces, I was not that scared because half of the class had braces. I had a very nice experience, great experience.
First, I was very scared because everyone used to tell me that braces hurts a lot, but when I came here, the staff treated me as I was their friend, so they were very friendly with me. And Dr. Amish Mehta, he treated me the first, so he was keeping me calm that nothing will happen to you, it's just funny, it's like a crack of joke. They used to treat me like I'm their friend, so I had a great fun with them.
The clinic over here is very good, clean and hygienic. Everything is very systematic here. The doctors are also very approachable. They are very punctual and very systematic about their appointments, about the timings. They are very soft spoken, every one of them. No arguments with the patients. They make the patients very comfortable with them.
Normally we feel scared to go to a dentist, but he's got such a good approach that we have no fright, no fear, and we feel that we are in safe hands. And he's got a fantastic staff and very good doctors. So overall his team is just too good. And I think I'm very lucky and very happy to have a doctor for me and my family like Dr. Amish Mehta.
मैं 120 किलोमीटर से यहाँ आता
हर महीने। मैंने बोला कि मेरे गांव में आप आ सकते हैं क्या? तो बोला ठीक है, आप बोलते हैं तो वहाँ आ जाएंगे। तो कैसे? तो मैं एक वान बनाता हूँ बिल्कुल क्लिनिक जैसी, वहाँ मैं आपको भेजूँगा डॉक्टर के पास, और ट्रीटमेंट अच्छी वहाँ भी मिलेगी आपको, जैसे सिटी में मिलते हैं यहाँ, तो वहाँ भी मिलेगी आपके गांव में।
Even in USA, I haven't come across any such facility which has a kind of a very elaborate and composite all the treatment under one umbrella. It's kind of amazing, you know. One of the incidents I would like to quote here, when we visited one of the dentist office in United States for the treatment of my wife. I talked to the American dentist about Sirac CAD-CAM machines, milling machines and other stuff that Amish has already put in place in Baroda facility. The American dentist started telling me that well, I mean, it's future of dentistry.
I got work done with my right cap replacement, and he did my extraction root canal that was left over in USA, and during that process I had almost no pain. I've been living in America for 36 years. Chandan Orthodontics, comparing to America and India, is the best facility I ever seen. That's all I can say about him. He's a great person.
And now, the man who revolutionized the Indian dental setup, bringing the best of the world to this clinic.
Wanted the dentistry and orthodontics and the other subjects of dentistry to get very premium position in India, to do work not only as the Western of the United States or the European standards, but to set our own standards, and catering to the needs of the Indian population in the most modern fashion, in the most efficient fashion, in the most hygienic manner. I just wanted to make dentistry look like very easy for people to get treatment. There's so much of dread, there is so much of fear of dentists. I myself feared dentists, and I wouldn't open my mouth in a dentist chair. There's nothing to be afraid of. It's just a phobia. It's just what people talk, and I'm not saying that tooth pain is not terrible, but the pain is terrible. But the experience of getting into a dental chair is very fine. It's so good, and I've tried to create that here. And there isn't a single practice procedure that has been done in the United States or in Europe in an advanced dental clinic that we are not doing. So we are always eager to conserve a natural tooth, and we do everything under the sky possible to save the tooth. We clean teeth, we do cosmetic dentistry, because these days, you got this social 6 thing, this 1, 2, 3, 4, 5, 6 teeth being visible. So it's known as the social 6. And that's what smile designing is all about. You speak through your teeth. There are syllables which are pronounced through the tongue being in contact with the teeth, the lips coming into contact with the teeth. So your speech is marred, your mastication is affected, your smiles are, you don't have a good smile when you don't have good teeth. So these are the reasons why we do the treatment. Orthodontics is primarily for function, because when you have crooked teeth, when you got teeth not in the correct place, they're going to get excessive loads, you're going to lose them much earlier. And of course, protruded teeth, proclined teeth coming out of your lips and of your mouth is of course an aesthetic problem. I don't need to stress on it. So these are the kind of procedures that we do. We are doing bleaching also, we are doing root canals, we are doing crown and bridge, we replace the teeth, we do immediate loading implants, and everything is done in the most advanced fashion. And anybody who comes here and tells me that, okay, why are you being so modern? I said, okay, why don't you go and drive in an old car? So why practice dentistry which is 40 years old? The world has moved, right? But having said that, let me be very prudent and very honest here, is that I never overuse technology. I only use technology where it is required. The approach is always old-fashioned, but the equipments are modern, because there are certain time-tested protocols. We don't touch it unless research proves it otherwise. To talk of equipments, well, when you think of a dental clinic, you think of a dental chair. We got them, we got 12 of them. And we got the hardware, we got the software, and everything. The practice is managed on a software, sitting at one place. A person can know what's going on everywhere. And we got the best equipments. While people talk of dental lasers, we got the erbium YAG laser. We are the only one in Gujarat who's got an erbium YAG laser. A very few in India who's got an erbium YAG laser. We also have a piezotome machine. We also have the implant kits, and we use the best, and we use Noble Active immediate loading implants, which are the best in the world today. We have CIRAC, goodbye to impressions, cumbersome things going inside the mouth. Well, the tooth is prepared, the tooth is scanned, and we design the tooth on the software. We give a command, it mills, and we fit the crown in the patient's mouth. And the patient goes. It's a single day dentistry. Even with immediate loading implants, we place the implants, we scan it, and we put the crown. So we are saving so much of time for the patient. In orthodontics, we are doing the most advanced procedures. We are using self-ligating, we are using Invisalign, we are using the people who are scared or dreadful of braces. Well, we have the Invisalign, which is again the best aligner technology of the world. We have it in-house. I'm an accredited Invisalign user, supplier. We do all braces, and whenever a patient walks in our practice, we first have a complete screening of the patient. I want to know that how best can I treat this patient with minimal treatment. The fundamental number one ethical principle in my practice is the patient's interest first. We have always kept the patient's interest before. It's always service before self. We try to do everything ethical. We are being truthful to the patient. We tell the patient the do's and the don'ts. What is possible, what is not possible. Our goal is to give minimal treatment, address the patient's problem, never do any unnecessary things, never guide or lure the patient into any dental procedure. We always try to do what is in the interest of the patient, what the patient actually needs. We are never driven by economics. We tell the patient sometimes that this is indicated, right, on a scale of 1 to 10. This is indicated on a scale of 8 to 10. So we always put choices, because, and another thing is, which is one of the most uncommon things which we do in our practice, is an informed consent. The patient is completely informed about everything, and then we initiate the procedure. So whenever a patient walks in my practice, I want to know about his or her medical and dental problems. Well, you can try us, you can come to our practice, and you can try us and ask us whether we do that, and we won't say no.